This is Dr. Vinod Arora from Indore. If I had to speak anything about musculoskeletal system or musculoskeletal disorders, first of all, I'll try to narrate about what musculoskeletal disorders means. And if I go for disorders, first I have to speak about what is musculoskeletal system. Basically, musculoskeletal system is mainly consist of muscles, joints, and bones. And this is a framework along with the dynamic part also, which makes our body active, which makes our day-to-day activities into action. So if I say this is one of the most important part of our body, I think this will not be a sort of exaggeration because people they always try to give more weightage to heart and lungs and other things. Probably they are also very important, but musculoskeletal system is most important because it keeps you mobile. Now, anything related to muscles, joints, and bones, this will come under musculoskeletal system. Naturally, tendons and ligaments, they do become part of muscles and joints. And this is how this system completes. Now, if someone asks me what is the importance of this particular musculoskeletal system or musculoskeletal health, I think I have already mentioned this that because of the mobile nature of a human being or any individual, any living thing, there are lot many disorders which are associated with muscles and joints, and any kind of disorder with these muscles and joints, tendons or ligaments, they can lead to acute pain. Means if someone gets some kind of sprain, for example, in some injury, or there is some trauma which leads to any kind of fracture, or if there is some inflammatory disorder like any kind of swelling in the joint or any kind of inflammation because of trauma, because of disease, this may lead to acute pain. Or if there is a bit of inflammation lying with any of this components of the musculoskeletal system, then also one is going to get chronic pain. Means you may have dull pain, you may have acute pain. These are the two things which can happen, which can hamper your day-to-day activities. There is a strong relationship between your day-to-day activities and musculoskeletal health. In case if there is any kind of issue related to any of this component, this may lead to loss of independence, means you may become dependent on others. This kind of disorder may lead to, naturally, if you are not independent, if you are dependent on some other person, some caretaker or some family member, it makes you little, it takes you to depression also. That I'm not able to do it. Rest of the people they do independently. I'm not able to do it. This may lead to depression also. And this has been proved in many studies that if an elderly person is not able to do his job well because of his joint pains or because of his immobilization or not able to move out of bed properly independently, they do get psychic issues as well. They go in depression. Any kind of disorder related to these components, including low back pain or any kind of shoulder pain or any kind of, say, muscular pain, this leads to your work loss. This leads to your early retirement. This may lead to a sort of loss of this thing also, the money part from money, economical part also, economic front also. So these are the things which do lead to uh, not only disability on the part of your health, but it do affect your social life, it do affect your economics, it do affect your mental status as well. If a person is not able to move out of bed properly because of weak bones, there is one common condition which is known by the name of osteoporosis, which is very common in elderly age group, especially in females, especially after menopause in females. This is a very, very common condition which can lead to disability, which can lead to, say, less activities on the part of the patient, and osteoporosis do lead to low back pain also, it do leads to fragility also, it do leads to pathological fractures also. This all comes as a burden on society. This overall affects their social life, their economy, their early retirement, and if osteoporosis is severe enough to lead to fractures, it may lead to your hospitalization, morbidity, comorbidities, and even this has been proved by data given in literature that any fracture which occurs after the age of 80, mortality rate is approximately 40% in first year after this kind of injury, especially femoral fractures, especially proximal femoral fractures. So how to counter all this? This musculoskeletal disorders, especially osteoporosis, arthritis. Arthritis do leads to lot many surgeries, including hip replacement and knee replacement. Knee replacement is more common with osteoarthritis. Osteoporosis is another very important problem with musculoskeletal system, which leads to economic burden as well as fragility. If I talk of how to counter all this, aging is something which cannot be countered. But we can, by doing certain activities, we can at least try to improve upon it, try to improve quality of life. And this comes to physical activities. There is a say in Punjabi, टुरदे फिरदे ना मरा बैठे मर जावा. Now this is one thing which states that if you are active, you will not, you are not going to die. But if you stay at one place only, if you are restricted to bed only, or if your activities are less, then you are going to die. And this is probably absolutely right. Physical activities has got big role for musculoskeletal disorders. If we keep on doing our routine activities normally, and if we include at least 20 minutes a day of physical activities, which can, which can increase your heart rate a bit once in a day at least, or you can say about 2 hours in a week if you invest on this particular aspect, that will be a great advantage for musculoskeletal system. It is going to counter our arthritis also. It is going to counter our osteoporosis also. It is going to strengthen your muscles also. It is going to tone up your ligaments and tendons as well. This has been recommended not only by me over here, but even WHO, they recommend such kind of schedule that minimum 2 hours in a week you must invest on your physical activities. If we talk of HRs, which probably we are going to face because of musculoskeletal issues, they are really tremendous. They can lead to your restriction of your activities. This can lead to severe disability, and even this can lead to mortality as well. As far as dietary issues are concerned, if we talk of diet, with diet, how we can improvise upon all these conditions, I think calcium, the diet which is rich in calcium, we must try and concentrate and consume this. Vitamin D is another very important uh, vitamin which is going to help us to come out of this kind of situation. And high protein diet, another very important aspect, especially those who are vegetarians. This becomes very, very important because if we try to calculate the intake of a vegetarian on protein front, probably we will find that most of us, those who are vegetarians, are short of proteins in their diet. Especially when you age, this becomes more and more important. So my emphasis will be on more and more of proteins along with calcium and vitamin D. Lot of fresh fruits. This is also going to help antioxidants in the form of antioxidants, which will take care of aging process. We'll try to restrict a bit, though it is unavoidable, but yes, at least we can maintain ourselves by taking a lot of fruits. This will give us enough of stuff to maintain our musculoskeletal system. But again, I'll emphasize more on physical exercises right from childhood. If someone is obese right from the childhood, definitely that particular person is going to have joint problems in future, early arthritis, and that will lead to all kind of troubles, including joint replacement, early joint replacement, and other issues related to musculoskeletal system. I think my final words related to, if I talk of musculoskeletal disorders, will be more and more physical activities and good diet, which is rich in calcium, vitamin D, and lots of protein. Thank you so much.